5 ways to manage PCOS. Polycystic ovarian syndrome is characterized by high levels of androgen hormones, such as testosterone, in females, resulting in failure of the ovarian follicles to release ova. This leads to cyst formation in the ovaries and symptoms such as obesity, acne, excessive hair growth, and fertility issues. Here are a few effective ways to manage PCOS. Number 1. Regular exercise. Physical activity majorly prevents obesity, one of the most hazardous symptoms of PCOS, further reducing the risk of developing cardiovascular diseases and accumulation of visceral fat around internal organs. Studies have revealed that exercise training significantly improved ovulation and hormone regulation in more than 50% of women diagnosed with PCOS. Body mass index, blood cholesterol, and waist circumference stay in check by aerobic exercises, thus reducing metabolic syndrome in PCOS patients. Furthermore, exercise stimulates the synthesis of endorphins, chemicals that instill feelings of well-being, preventing anxiety and stress buildup in women with PCOS. Number 2. Improving your diet. Anti-inflammatory foods such as berries, leafy vegetables, and fish may help reduce PCOS-related symptoms. Food sources with a low glycemic index such as whole grains, legumes, and nuts are digested slower and do not raise insulin levels like processed meat and carbohydrates do. Doctors also recommend a diet low in sodium and saturated fats to avoid the potential risk of hypertension and cardiac disorders. A 2015 study revealed that PCOS patients who followed a low-carbohydrate, low-sugar diet that was rich in fiber over a period of 8 weeks observed regular menstruation. Fried food, sugary beverages, and excess red meat need to be avoided at all costs. Moreover, it is advised to replace caffeine with green tea. Number 3. Stress management. Maintaining low levels of stress hormones, or glucocorticoids, is extremely crucial, particularly for PCOS patients since stress is known to worsen PCOS symptoms. The brain region called the hypothalamus stimulates the pituitary gland to reduce adrenocorticotropic hormones, or ACTH, which not only raises cortisol levels but also increases the production of adrenal androgen hormones, the culprit behind PCOS progression. Stress reduction is the key to manage PCOS effects according to endocrinologists. Several effective ways to reduce blood cortisol levels include mindful meditation and relaxing activities. Research portrays that reducing psychological distress in PCOS patients is linked to their significant improvement over time. Number 4. Managing your blood sugar. PCOS increases the risk of developing type 2 diabetes mellitus, which is characterized by insulin resistance. Statistics reveal that more than 50% of women with PCOS either suffer from diabetes or prediabetes before the age of 40. It is advised to limit added sugar in order to prevent worsening of PCOS symptoms. Avoiding excessively sugary foods and highly refined carbohydrates can help prevent an abnormal raise in blood glucose concentration. This further helps in restoring insulin sensitivity. Decreased insulin levels lead to a decline in the release of androgen hormones. Apart from refraining from sugar consumption, PCOS patients are advised to substitute simple carbohydrates, or simple sugars, with fruits and juicy vegetables. Number 5. Medication. Commonly prescribed medications include a variety of options, such as combination birth control pills or oral contraceptives. These contain estrogen and progestin, which help regulate both the ovarian and menstrual cycles, thereby reducing the severity of PCOS symptoms. Moreover, hormonal regulation by oral contraceptives can reduce the risk of endometrial or uterine cancer in PCOS patients. Progestin therapy is another method of regulating hormone levels to